I think that what is important, if you'll allow me, is tailoring the treatment to the patient. And as people out there listening, you can really help your provider a lot. So the first question is, what formulation are we going to be looking at? And I realize that people with migraine often have different kinds of attacks. Not every attack is the same, right? So some people will have attacks that have a prodrome, they may have an aura, they may have, hours go by before their pain peaks in intensity. They're not really nauseated at the beginning, but they get more nauseated as the attack progresses. And so for these people, oral medications taken early probably work well. But then there are other attacks that either wake people up from sleep, okay, in the middle of the night. And when that happens, it's kind of like the train has already left the station. Often the attacks are pretty much close to full blown when it occurs. People are nauseated. And we know that the changes in the brain that occur with a migraine, which are called peripheral and central sensitization, the peripheral sensitization comes first. That's like the part of the trigeminal nerve that's outside the brain. The central sensitization is inside the brain, and it takes about an hour for central sensitization to occur. And once that occurs, the migraines get much harder to treat. In addition, once people start getting nauseated, they're much harder to treat. And we know that the gut's not working well in general during a migraine, even without nausea. So once people start getting nauseated, the likelihood of being able to swallow a pill, have it dissolve, have it be absorbed, and be effective goes way down. So it really helps if people let us know, how long does it take for their pain to peak in intensity? And if the pain peaks in intensity, we know once the attack starts, within an hour or less, we're going to start thinking about using non-oral treatment, either an injection or a nasal spray, or in other countries, a suppository. We're going to start thinking about using more aggressive antiemetic treatment, either a suppository or a transdermal, because we have to bypass the gut. The gut's not working in our favor, right? Headaches that people wake up with, right? First thing in the morning, same thing. It may be too late to take an oral medication. And I think for a lot of people, the reason their acute treatment fails is because it's not the right acute treatment.